Quiet in here. Good evening, ladies and gentlemen. Welcome to this special meeting of the Town Council. We keep having these meetings so frequently, I think we're just going to start issuing keys to the building. But that being said, thank you for coming. This is primarily, first off, an update on the COVID numbers for the council to digest and to consider, if they so wish, other options. So if you would, please stand for the Pledge of Allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. This evening, there will be no public comments. This is strictly for informational purposes, and we'll go from there. So I would like to lead off. Mr. Fox, can you pull up some latest information on the COVID numbers, how we stand, how the state stands for the council?
Certainly. If it's okay, I thought I would start with just a reminder that we are still currently under a state of emergency that went into place August the 24th, 2021 at 5 p.m., and it was until further notice. That state of emergency did instate, while indoors in any establishment open to the public and in areas that are open to the general public, all customers, employees, and any other occupants or users of such areas shall wear a face covering. While wearing face covering, social distance shall be maintained so far as possible. So just a reminder that we are still under a state of emergency. Ms. Jennifer Green was here last Tuesday and shared some data. She has given me some additional data that's been updated by week. Just a few slides here to share. First and foremost, she wanted to share the vaccination data. I think it's up another percent since last time she was here to 57% fully or partially vaccinated, 13% to the goal of 70%, which is what Watauga County would like to see ultimately. You'll see there on the bottom right-hand corner the demographics of the age breakdown of the vaccination, with 89% of 75% and older down to now 11% of the 5 to 11-year-old range. She did provide an update. This is a chart that you saw last week as well, starting the week of September 12th through the 18th and showing the number of active cases each week broken down by each group. It's not on this slide, but the latest data is 66 for the week of 11/7 through 11/13. And once again, I've got a breakdown here of the age, showing 0 to 5 up to 65 plus as you look at the last 2, 4, 6, 8, 9 weeks. And then the last update slide that I have here, a real simple presentation. A lot of discussion in the news, I guess, you hear about percent positive. This is a slide that was not presented last week, was discussed, but an update here showing starting on 11/3 each day up until 11/15, which is the latest data that the North Carolina Department of Health and Human Services provides. So 2 days ago shows a 2.9% beginning of the term here on 11/3 to 3.3% on 11/15. You see some fluctuation there, 2.9, 2.7, 2.6, 2.5, 2.8, et cetera, as you go through. So real simple update. I didn't want to provide a ton of data. I know she did last week, but I'm not sure if I can answer any questions. Would be glad to pull up anything additional or try to answer any questions that you may have.
What's our color are we in transmission rate?
It's still in red.
Red?
And how is the transmission rate determined in terms of red or, do you know?
Correct me if I'm wrong, but I believe it's the number of cases per 100,000 determines that.
New cases.
New cases per 100,000 in population. So our population is obviously less than that, so that's just a formula.
And today's is 128.17, which is off of the CDC website.
For where?
Off the CDC, the state's now using the CDC website. And they actually have the positive rate at 3.92, which is up from last time.
Is that
she
the
gave it.
state or the county?
County. Watauga.
I tried to provide sources of data. I pulled this from the state website. Wasn't sure exactly which resource to use. So this data comes from the North Carolina DHHS website.
Last thing I read was 3.3, so
That's what I read.
where's the disparity coming from? Dates?
The date that I pulled up, 11/17, was 3.92. And that was off of the CDC, so. There may be a lag from 3/15.
Now, you're talking about Watauga County.
Correct.
Okay.
Shane, have you spoken to Ms. Green since our last meeting?
I have
When was that?
yesterday and this morning.
Did she relay any changes in her recommendations?
She did not.
Okay, thank you.
And the town of Boone met last night. Did they make changes in their emergency order or their mandate?
They did not.
How about the school system?
They did not.
Can somebody explain and define in layman's terms this positive rate that I hear so much about? 5%, 2%, 3%?
Sure. It's simply the number of positive cases in any particular day divided, or the number of cases tests given by the positive case, number of cases. So, for instance, 100 tests given and 3 people were to test positive, that would be 3%. So number of tests given divided by the number of positive cases equal the percentage of positivity.
Do we know that figure for here?
Well, the data that I have, and I pulled it up, I'm not sure, I pulled up the CDC website, is the state website, and it is 2 days behind, 11/15. It's at 3.3%, and that was out of 1,925 tests that were given. And then you'll see here the last, what looks like almost 2 weeks, 12 days worth, both the number of tests on the right side and the number of percentage positive on the left side.
One thing we have to keep in mind too, back when the state pulled the mask mandate, their percentages were not counting children. Their percentages were just counting people that could qualify for the vaccination. At that time, we were just a tad bit over 5%, and they dropped the mask mandate. The state did, the governor did, okay? Now, everybody is falling into that percentage, that category. Children, older adults, and middle-aged. So
Yeah, I think the issue, the children were not getting it.
that's right.
It was the adults that were getting it. So they weren't included because they didn't get it, but now they are
Well, they
getting
They
it.
also weren't including it because the kids could not get shots.
They are now.
Yes.
Boy, and I tell you, the county they've stepped up. They're giving them at the schools.
Mm-hmm.
The pediatric groups are giving them. The appointments are full, so I'm really proud of them.
But we do have to consider that the pie has gotten bigger.
Yeah, the
how
other
they're calculating.
the other thing that's not included in here are home tests. The home tests are not considered because you don't have a count for that. So your percentage may be lower because you don't have the home test included. So
Exactly.
and they've become large now. People are doing the home
How
test.
accurate are they?
Probably as accurate as the Bionex.
Really?
So they're just expensive.
Yeah.
They're like
It's on the
$40,
Walgreens.
$50.
Yeah,
Which, who's going to be able to afford that?
yeah, that's true.
What state mandate are you relating to?
If you remember, the governor back last year put into place mandatory mask, okay? And that would, they stated they were going to lift that once the percentage of positive cases dropped, okay?
Indeed.
And he did. And it dropped to 5%, or don't hold me to the number, but something like 5%, okay? And they dropped the mask mandate, okay? But children were not, essentially, children were not falling into the numbers yet. Now, well, and I say children, teenagers weren't falling into the numbers. Now, children, teenagers, everybody's in the big pie. So when we look at these percentages, we're looking at the total population of positive cases where we weren't before. Okay?
So you're saying the state of North Carolina, under present governor, what figure did he use? Do you know?
They were, Andy Cohen was pushing for, was it 5%? So wasn't that right?
I don't know, but I know that when the numbers went back up, they really relied on the towns and the counties to put the mask mandate in instead of the governor.
The governor did not want to do it.
He didn't want to do it, so he made us do it.
Yeah.
And,
Well, he didn't make us. He gave us the option.
right,
Yeah.
right. But it was just that he wasn't going to.
How many towns in North Carolina have the mask mandate in place now?
Hope you're not asking me.
Last I saw, 4.
How many?
4.
40?
4.
4.
Guilford lifted theirs, Mecklenburg lifted theirs, New Hanover lifted theirs, didn't they?
New Hanover lifted, Guilford
They did.
lifted, Mecklenburg did not lift.
They did not. They were talking about lifting when it got to 5%. That's right. Asheville, Buncombe, Boone, Boyne Hall.
Oh, that haven't?
Yeah.
Well, I think what's happened in September is Denmark and UK, their vaccination rate was great, their numbers were low, and they lifted restrictions, and now they're having to go back. They're now having another wave. This is a sneaky virus. And so Denmark's now, in 2 months, going to have to put their restrictions back on. And UK, I think, is the hub of where everybody travels. I think one of the things we have to realize is that people are going to be traveling on planes, traveling to different areas. And if we're going to see a wave, we should see it as a result of Thanksgiving. We should see it 2 weeks after.
But you're not saying definitively with any proof that the mask made that happen or not happen?
With who? Denmark?
Denmark or?
Well, Denmark is
They do-
going back
they
to
do
mask.
whatever.
No, Denmark's going back to mask because they're saying that they now have another wave, and they opened everything up. They opened the bars, retail, took the mask away, and they had a better vaccination rate than we did.
Thoughts?
Doug?
My thoughts are, right now, is that the county is not under one. That was a little misleading the other night. They are in their own buildings. That's it. It's not the county is under one. I'm not, no matter where you go anymore, it doesn't seem that it's being enforced. Boone may have it, but go about anywhere you want to in Boone, and I don't see it. I'm looking at it, and I try and use what I thought Mandy Cohen had used and what I've heard Fauci say is that 5%, 5%, 5%, that's all I've heard. And I feel that we've been under that for a while, but I feel if we vote to go out of it, that we should also have the way of when we need to reestablish it going back. So if we're using 5% as that number that we stay below, and we're saying a certain period of time, say if we're staying below that for 14 days, then we're lifting it, then I think, there should be a time period put on it that if we go above the 5, such as 7 days, and I'm just throwing numbers out there, so don't get me, don't nail me on this. I'm just saying if we go above the 5 for, say, 7 days, then it needs to be put back on. That's just throwing you something out to digest and think about.
Well, I'll have to say that I agree with Doug. The problem with the mask mandates, a lot of things that are put into place that there's no enforcement, okay? And really, how do you enforce it? I don't have a problem with the mask. In the wintertime, it keeps my face warm. But I think it's by choice. I'm to the point now where I feel like, personally, because I have people that work for me that are at risk, and they choose to wear masks. And that's good. But I kind of wondered the other night when we were listening to Jennifer Green, I would have liked to have heard her say, this is what I'm shooting for. This is what I want to see. 3%, 2.5. There was no definitive number. And so it does. It puts the ball back in your laps to make a decision.
Well, you're also using one criteria. So that's not what the recommendation was. The recommendation is not just use percent. You have to look at hospitalizations and increase of cases.
How many were
Cases are going up.
hospitalized?
There were 7 on the 15th and 6 on the 17th.
Right.
So whether any of those 7 got out, I don't know. But, that's the other issue. It's not just one criteria, and y'all are focusing on that. And she did recommend that you use other criteria.
Well, and that criteria has been used. And the state used that criteria when they lifted the mask mandate.
Well, but that was a year ago, and we're in a whole different place. So bringing that up,
Numbers are a lot
this is a
lower.
whole different ballgame that we're looking at.
Numbers
So
are lower, though.
We didn't have the Delta virus back then. That was a different virus. It wasn't as contagious. This one is more contagious than, or as contagious as chickenpox. Anybody who's ever had a child in kindergarten knows what that's like.
Mm-hmm.
So I think it's a whole different, it's a different idea. The deaths went up between, I think, the day that she had, that she gave us the data, we had another death, so we're up to 40. And we're still in red. And if we're in red, there's a reason that the state has put us in red, which is a high transmission rate. So, if you want to use that criteria, then wait until the numbers go down to where they get us out of red. I mean, Ash and Allegheny are both gone up. They've had more cases in the last week. So it's around us.
And it always will be.
Well, I hope not. I hope that by next spring we'll be over this. I mean, I hope that I don't think I like wearing a mask. But, if it protects other people from me, then I'm willing to do it. So,
Where does the red start, Sue? Like Catawba County today, which
which is down the mountain, my home county, is 6.2. Now, does that put them in the red or the blue or the green or what?
Well, the state's red, isn't it?
I don't know. I don't know. Where did the red come from? Who dreamed it up?
Okay.
Looking it up.
Yeah, because I don't know. So if he wants to pull that up and use it as a criteria, that'll be on the website.
May I speak?
Of course.
Okay. I just don't understand how we can sit here and totally ignore what Jennifer Green told us last week. We rely on experts. We just paid $12,000 and change to do a study on Green Hill Road so that we could justify putting 3 stop signs. We relied on those experts to justify that. No one sitting up here, with the possible exception of Sue, and I don't think Sue is an epidemiologist, are you?
No.
Okay. Are qualified to make these calls. And in the absence of that expertise, we have to rely on experts. And that is App Healthcare and North Carolina Department of Health and Human Services. And we've done that since March of 2020. So what is the justification other than you're just tired of wearing a mask to change this? Where is the expertise up here that can justify this?
No, I won't say anything's expertise, just like I won't say Jennifer is, just like the question I asked her. If she works for the county, how come the county's not under a mask mandate?
Exactly.
You know, I asked that. If she's an expert on that and the numbers are that prevailing and we're getting the dark and dismal,
I'm sure
how
she
come the
gave-
county is not doing the dark and dismal?
Well, I don't care what the county's doing.
No.
I'm sure she gave the county the same recommendation that she gave us.
That's the reason I look at, most of it's in Boone, so I don't look at Boone. I look at what I feel is going on here in Blowing Rock.
What you feel.
What I feel. Because none of us are an expert, you know.
No, we're not.
But we, unfortunately, we are tasked with these decisions that we have to make.
Yes, we are.
So it doesn't really say, it just has 4 different levels, blue, yellow, sort of an orange, and then red. And red's the highest. And I can't pull up, but let me go to county.
Do you want to pull something up here? See?
Yeah.
Where are you?
I'm on the, well, I just flipped to CDC, but I went to the North Carolina Health and Human Services.
CDC.
CDC website.
Well, that'll give you the numbers, but this is the, yeah. It doesn't really say. So this is where I got the information that I just told you about. Let me go to the. My talk is all the way down there. So community transmission is high. Everyone in Watauga County, North Carolina, should wear a mask in public. Indoor settings. Mask requirements might vary from place to place. Make sure you follow local laws, rules, regulations, or guidance. How is community transmission calculated? Oh, here it is. If 2 indicators suggest different transmission levels, the higher level is selected. So it's new cases, which was the rate that you were talking about, over 100,000. So it's new cases per 100,000 persons in the past 7 days. So if it's greater than 10, you're in red, or less than 10. If the percentage of positive NAAT tests during the past 7 days is less than 5, you're also in the red. So they're looking at 2 criteria to get us in the red. The higher level is selected.
You know what's amazing to me? You look at South Carolina, they've not had any mask mandates.
Well, yeah, they all had COVID. They're not going to have a high rate because they all have it. Same with Florida. You know, their rates are low, but everybody there had COVID. I mean, they were getting it so fast that the healthcare providers were struggling. So I think there's more than, do you want to see this or you trust me? You trust me, right?
I trust you.
Okay, good.
Always have.
Yeah, so there's 2 indicators to give us our transmission. That's the new cases, and that was the 128.17 that I said, that I got off of the same site. And then percent less than 5 of positive and of the NAAT test during the past 7 days. So they're using more than one. So that's why we're not dropping from red to that weird orange or the yellow. And look at who's around us. Everybody around us is red. And, you know, the other issue that she brought up was that we're going to be inside. You know, our weather's cold, and when you're inside, you can't do the 6-foot social distancing. So,
That's true. But you go into a restaurant, no one's wearing masks.
well, and maybe that's something that Mr. Fox needs to discuss with business owners. What can we do to help you with mask wearing?
If they're sitting at a table drinking a sweet tea, they don't wear masks.
Well, I know you were just saying it wasn't enforced.
Well,
You made a statement that
you
it
don't-
wasn't
you
being
don't-
enforced.
When someone's sitting down eating in a confined space like a restaurant,
Yeah, well, hopefully I'm eating and not talking, because I'll choke. But I think we've been doing that. It's just, letting the mask up. There may be people that may not be protected. So if enforcement is an issue, then I think that's something Mr. Fox needs to deal with. If you feel like enforcement is not being done in Blown Up.
I don't see how we can enforce it.
Well, I would leave that to Mr. Fox because I think he's, as a manager, can work with the businesses, whomever, police if that's necessary, if their presence is necessary. But I mean, that's not for us. That's a management issue, and I think Mr. Fox can handle it.
How many times have the police been called to enforce the mask mandate?
Once or twice that I recall.
I've received, since the last time the town implemented mask mandate, I've had 4 complaints.
So that was August?
No, they've been spread out over the course of the last few months.
Oh, okay.
Since August the 24th, though.
Yes, since August.
Yeah, okay.
So this is the 9th most populous state in the nation. And he's been called 4 times. And there are 4 municipalities in the 9th largest state in the nation that have a mandate. Is that right?
I don't know the number there. I don't know how many have a
You
mask
said it like
mandate.
that.
Guilford lifted theirs.
Well, you said 4. I don't care who lives there.
Oh, 4?
Yeah.
Last I heard was Buncombe, Boone, Blowing Rock, Mecklenburg, and Durham.
Now, how about Mecklenburg? Did you say that?
Yeah, they're holding off.
They've got theirs on.
Yeah, they're holding off till they reach less than 5%.
In what period?
I think 14 days. Is that right, or 7?
It was 30
They dropped it. to
they
7.
dropped it to 7.
7.
5% for 7 days. Masks remain in Mecklenburg for now as threshold to end mandate remains elusive. Guilford County ended its mask mandate, but masks are still required in these contexts.
In what?
These contexts. I'm just trying to pull it up here because I didn't know about this.
Healthcare.
Mask mandate allow more freedom for people who are vaccinated to go mask-free. So you may still need to wear a mask in certain businesses or while visiting schools or county facilities because, like Watauga is requiring it in all their buildings. Businesses continue to have the authority to implement voluntary guidance regarding their own operations and can restrict service to customers who choose not to abide by reasonable and lawful safety restrictions such as wearing a mask and other COVID-19 precautions. So that's putting more on the businesses, which I don't know that they would want that.
It should be up to.
Guilford County employees and visitors to county facilities such as the courthouse and various offices, and this is Guilford County, must wear masks indoors. School districts are, let's see, that has to be approved by a local school board. And so our school board did not lift the mandate. They're having trouble with the kids that are eating lunch outside. They're not 6 feet away, so when one of them gets it, then they're putting them all on quarantine that are around them. Guilford County officials reminded the public that federal mask mandates require masking in all federal transportation, such as buses, trains, and airports, and for most medical facilities. So that's, let's see. So that was Guilford. I only pulled that one up, and then Mecklenburg. Do you want me to keep going, or is that enough?
No, that's pretty standard. I mean, healthcare.
Yeah, I mean, I don't know how many, and I don't think,
No, and I think what you were talking about with what I've read with Dr. Elliott is that his biggest problem is the quarantine rule. He said if it wasn't for the ones being vaccinated, he'd send the whole school home because of the way it's set up right now. He's kind of hoping that will get changed some.
Wake County extends mask mandate, so that's, Wake is Raleigh, citing key COVID-19 metrics and CDC guidance. So they're doing what you asked, is to follow the guidelines because we're not epidemiologists, and that's where they are. So, like I said, I don't think any of us like the mask thing, but we're just not out of it. It's a little premature. We've got some issues. If you want to look at it, why not maybe do 2 weeks after Thanksgiving? You'll have that'll be your December meeting is 14. So that would be 2 weeks after. And you could say, okay, did we go up? Did we not go up? And then that might make you feel better that maybe the masks, is it 14? That that the masks, maybe more people will be vaccinated. The kids are getting vaccinated now. The little ones, the young ones get half the dose 2 weeks apart, and then they're not considered, their immunity is not high for 2 more weeks. So that would put you about at your first meeting in December.
And the incubation period is?
For the immunity, for the kids, it's 2 weeks after the second dose.
So that would put us right about.
It would put you at your December meeting. And that might be the time to really look at it.
But then what number are you looking at?
Well, I think you have to look at more than just one.
Right, but I mean.
And it may be that if the transmission rate drops from red to orange or whatever the color is, that then you're in a better place.
I don't see the red changing for a while.
Well, it's changed around
They
us.
set the guidelines on.
Do you
the
have that?
transmission rate.
Do you have that? Because we were all red. See, some of them are getting to the orange. And I don't know what that county is down there that's
Graham.
Graham? Okay. But, we were all, the whole state was red.
I think you're going to see a lot of the numbers drop anyway because with ASU getting ready to get out and go home, you're going to see a lot of the numbers drop anyway.
Well, except that a lot of your servers are staying. They stay and work during the
But all your kids will be gone, most of your kids will be gone.
but, get to orange and then say, well, maybe we can do it. But, look at how many are red around us. So, it's just something, it's up to y'all.
You got a thought?
Well, I'm just having problems, and I don't mean to imply that Roy Cooper, the governor of this state, and I are on a first-name basis. We aren't. But I know him, and I've been in contact with him in the last few years, maybe twice. And I didn't notice any feathers on his legs, and he has not made this state a mandate state.
No, but he has mandated that his employees, if they need to be vaccinated, if they're not vaccinated, they have to be tested, and those who are unvaccinated have to wear a mask. And personally, I have a problem with pointing out who's unvaccinated. I don't think I would want to do that.
Wouldn't want to do what?
Point out the employees that are unvaccinated. I don't like that. That's why I like, okay, we all wear them, because nobody knows whether I'm vaccinated or not unless I tell them. But pointing, I didn't like that part of his executive order, but it's still in effect. And he also put in that anybody who delivers things to the state has to have the same thing. But he just said he masked the unvaccinated and he tests in everybody that's unvaccinated once a week. I'd have a problem with pointing out to basically you're saying who's unvaccinated. That's why I like us all wearing masks.
They're running on the honor system.
Well, now they have to prove it. They have to prove that they're vaccinated, so.
Well, I'll make a motion.
Okay.
This town has been under the 5% rate for the last 14 days, 2 weeks, that we stay the mask mandate. If this town rises above 5% for 7 consecutive days, 1 week, it'd be reinstated immediately upon notification.
And should we allow Shane to take that on?
No.
I think
Yeah.
we set policy.
Yeah, state of emergency is set by majority here. So that would have to be majority here, would have to state that. And I would recommend, just to be thorough, if the motion moves forward, that it would be this group after 7 days come back together and discuss that.
All right. Does that complete your motion, Oliver?
Yeah.
Could you read it again,
Yeah,
please?
you're not, I couldn't.
Let the clerk read it.
If the numbers stay under 5%, then there will be no mask mandate. If it rises above 5% for seven consecutive days, then the board will be back for a discussion to have the mask mandate implemented.
I'm making the motion with the intent that if we go over 5%, it's a done deal here tonight. We just meet and say yes.
And when would you, in your motion, when do you want this effective?
At the close of business of this council tonight.
Do we have any seconds?
I'll second.
Excuse me?
I'll second.
Any further discussion?
I would just say it's premature, that you need to wait until after Thanksgiving, but I think that's going to be a big risk for the people that are here.
I don't see how we can get any more people over Thanksgiving than we get every weekend.
Well, you're having a Christmas parade So that's going to increase your number. And how many do you have, Jennifer, coming usually to the Christmas parade?
A lot.
1,000? More than that?
More than
I
that.
can't hear. I cannot hear.
You can't hear?
No, there's too much noise in this room.
I mean, what's the most you've ever had?
Pete?
We haven't been able to truly get true numbers, but we have a lot of people in town for Thanksgiving weekend for sure. Whether it's the light in the town or the Christmas parade.
So when you used to get the pings, what were the pings numbers?
We estimated people at the parade in July was probably around 8 to 10,000 is our estimation.
How many of the last couple of weekends pinged at using the bathroom out here?
So we're averaging, 7-day average is more than 1,000 a day. I mean, that's through the week. Weekends are probably 3,000 to 4,000 a day using the restrooms.
And when we had the July 4th parade, the town was saturated. Did these rates we're talking about go out the roof?
Well, everybody was
I
masked.
couldn't answer that.
Everybody's
No, they
masked.
weren't.
We had a mask mandate and people were masked, more so than not.
No. Not July 4th.
Yeah, we were still on the mask mandate.
The state wasn't.
If I may just clarify the motion in the second. So it would be remove, the state of emergency would no longer be in effect as of the close of this meeting.
That's what I said.
If we have 7 consecutive days of 5% or above, we would reconvene to
Right.
put back in place the mask mandate. What 7 consecutive days would you like for that data to be presented on? Any 7 consecutive days moving forward?
Yeah, Sunday afternoon, but
Okay.
fine with me.
So any 7 consecutive days?
Yes.
More discussion? David?
Yeah, I would just like to say that I would love to lift this. I'm tired of wearing a mask. I'm tired of all of it. But I would love someone that is in the right position and with the right credentials to give me a good reason to lift it. And I have not heard that at all. Everyone here heard the same thing I did when Jennifer Green said it is too soon to do this. Who do you go to when you need a physical?
My physician,
Because they're expert.
he feels like that the mask has had their place in time.
I just hate
That was a month ago.
I hate that this council is basing this on what they feel and their opinions in an area that shouldn't really have any place in it. It really should not. And I think this is premature and irresponsible.
All right, if I may, counsel.
Well, David, I appreciate what you say. Some of that's conjecture relating to me.
Okay. If I may say something. You know, like I said early on, you know, the masks, I mean, I've got 2 daughters that are nurses. They've worn masks for forever since all this took place. You know, but I am in favor of choice. And I'm in favor of, you know, I've never been one to feel like that businesses should be told down to the wire how to operate their business. I feel like now we're at the point that it is individual choice, business choice, which I don't think's wrong, but you're correct. I am not a physician. I have to rely on what I believe is correct by what I am told, just like the rest of us. And so.
So how can you deny what Jennifer's telling us, that she would not recommend the mask mandate being lifted?
She's not a physician, and she's not a specialist on disease, but we do rely on her.
She has a master's in public health, and she is.
That's fine.
She
And
does
I'm
know
not saying,
stats.
I'm not saying she doesn't know what she's saying, what she's.
Well, and there's more people in this town besides businesses.
I totally agree.
So I think that you need to also include other people besides just business.
I don't disagree with you. Okay.
Just saying.
No rushing, Mr. Diaz.
Okay.
So can,
All right. If there's no further discussion, Doug?
All right, then David has something to say?
David? Oh, you
No.
sure? Go ahead.
I'm fine.
You sure?
Yes, sir.
Okay. Doug?
Yes.
Sue?
No?
David?
No.
Albert?
Yes.
Charlie, yes. Okay. Do I have a motion to adjourn?
So moved.
Do I have a second?
Second.